Hello wonderful students, myself Dr. Maddineni Srinivas, Dermatology faculty from Bharat. So in this video we're going to cover the extra-articular manifestations of rheumatoid arthritis, which was a theory question asked in RGUHS Karnataka. So let us begin our discussion with the basics of RA. RA, I hope all of you know, it is mainly the inflammation of the joints, but not only joints, even other organs are also going to have the inflammation, because of which there can be various clinical features. So let us see one by one. So systemically, the patient is going to have the constitutional symptoms: fever, arthralgia, loss of weight, weight loss, fatigue. So all these features you can write down because of the inflammation happening in the body. And in the muscles, there's going to be muscle wasting because of the inflammation. And there can be inflammation of the bursa leading to bursitis, tendons leading to tenosynovitis, and also there can be osteoporosis. That is because of the inflammation, also the steroids which are used in these patients. Coming to the skin, so the patients are going to have the rheumatoid nodule. So just write down this term, rheumatoid nodules, important. What are these? Basically subcutaneous nodules which can be seen in 1/4 of the patients of the RA, and they are mainly seen over the pressure points, as you are able to see here, IP joints. They can also be found over the olecranon, sacrum, Achilles tendon, and all the other pressure point areas we can see them. And also these rheumatoid nodules can also occur in the viscera also. And they don't require the treatment, but if they are painful or if they are interfering with the movement, treatment might be required in the form of steroid injection and local anesthetic combination. And in the skin there can be vasculitis, that is inflammation of the blood vessels, and also pyoderma gangrenosum can also be one more presentation. In the eye there can be inflammation of the sclera, episcleritis and scleritis. And in the respiratory system there can be pleural effusion, and also alveola can show the inflammation, alveolitis and bronchiolitis. And this Kaplan syndrome, I hope all of you might have heard. If RA is associated with pneumoconiosis, it is called as Kaplan syndrome. So in the heart there can be inflammation of the pericardium, pericarditis, myocardium, endocardium inflammation, coronary blood vasculature, inflamed coronary vasculitis, and aortic regurgitation, AR, can also be seen. And also conduction disturbances may also occur. Okay. And in the blood there can be anemia, which is because of this is a chronic disease. There can be normocytic, normochromic anemia, and also increased platelets and increased eosinophils could also be associated with rheumatoid arthritis. Splenomegaly is associated with Felty syndrome. I hope all of you know this. And in the neurological, just remember there's going to be subluxation of the joints, because of which there can be compression neuropathies, carpal tunnel syndrome, and also tarsal tunnel syndrome. And there can be also cervical cord compression, peripheral neuropathy, and mononeuritis multiplex could also be associated. And there can be systemic vasculitis and amyloidosis, though it is a rare condition. So remember, extra-articular manifestations can involve multiple systems and significantly impact the morbidity. There's going to be a lot of pain because of the inflammation. So that is the reason why early recognition and the appropriate management are very crucial for the prevention of the complications due to the extra-articular manifestation. So I hope this video was helpful. So please do hit that like button. Also do subscribe for more of this content. Okay, comment if you have any doubts. Thank you so much. Happy learning. Bye bye. Sarvam Sri Krishna Sarvejana Sukhino Bhavantu.